The Civil War era was a time of big medical advancements. However, practices were still rudimentary and soldiers often died of infection rather than in the battlefield. Dysentery was their number one killer. Other common diseases included typhoid fever, smallpox, measles, diarrhea, pneumonia, malaria, and tuberculosis. The practices often made things worse. Medical officers would mistake symptoms for tuberculosis or malaria for diarrhea, dysentery from the poor food they ate. This resulted in 50,000 deaths for the Union and even more in the Confederacy. Minor and fatal wounds were ignored, the most treatable injuries being taken in first. In most cases, these were arm and leg injuries and often resulted in amputation. Operations would often be septic, with surgeons working in blood-stained suits and using unsterilized equipment. Doctors never realized that the pussing wounds were developments of Staphylococcus aureus. The patient would frequently catch surgical fever and die within a week after surgery. Doctors thought this disease to be airborne and didn't understand that it was a result of infection. Surgeons had two amputation techniques, flap and round. The flap technique was preferred despite its increased risk for infection. Surgeons attempted to save patients with chest injuries by plugging up the wound. However, this would also seal in bacteria and cause infection. The Civil War did have disinfectants, which include iodine, carbolic acid, bichloride acid of mercury, and sodium hychloride. These, however, were not used until the wound was severely infected. The Confederate Medical Department often received criticism for its lack of ambulance use, as they often used farm wagons instead. General hospitals didn't regulate their admissions like specified hospitals did, but they were often found unsatisfactory due to inadequate plumbing, bad ventilation, and crowding. Washington was the hospital center for the Union, but it was an unsanitary place and a breeding ground for intestinal disease and mosquitoes. Bacteria ended up killing more soldiers than the battles did. The men would often get sick and die because of the poor sanitary conditions. Despite this grotesque factor, there were a good deal of medical advances during the Civil War. The Union Medical Corps started with only 87 men, but by 1865 more than 11,000 doctors had or were serving the military. Dr. Moore created regulations and exams for surgeons and spread the use of pavilion hospitals. He also fought hard to prevent drug shortage. He established laboratories, ordered supplies from Europe, and distributed native herb and plant books for educating in alternative medicine. After the outbreak of war, men and women alike rushed to help the Union soldiers. Pamphlets written by respected doctors on sanitation were distributed. A few months after the war, it was decided that 2 assistant surgeons were needed. In 1862, field hospitals began getting bigger and better. Regimental hospitals clustered together to make brigade hospitals. Brigade hospitals clustered together to make division hospitals. By 1864, most armies had corps hospitals, where the best surgeons would operate. Jonathan Letterman developed the Letterman ambulance plan, where ambulances moved in a division with 1 driver, 2 stretcher bearers, and a line surgeon. The Union adopted the use of railroads after the Confederates and developed an official hospital train. William A. Hammond made an effort to change medical formalities after he resigned from assistant surgeon. He wrote a textbook on military hygiene. Hammond received congressional authority to develop the Army Medical Department, but it had little effect. The prestigious doctors were only used as staff assistants, and the department had little say for increase in surgeons. Higher authority found that they would rather fill their army with new men rather than try and fill it with seasoned soldiers. They continued to let state governors select and commission surgeons. Unfit surgeons were only weeded out after several re-examinations. Hammond was discharged from the army after losing the favor and sympathy of his colleagues. In 1864, the Ambulance Corps Bill became law, and the Letterman ambulance plan was extended to all armies. The Army Medical Department got to select the ambulance team, but no ambulance corps was ever officially created. Special hospitals were experimented with in both armies. The Confederates developed venereal hospitals, which specialized in sexual disease, and ophthalmic hospitals, which specialized in eye disease. The Union also adopted venereal hospitals and developed neurological hospitals. Based on the results of Florence Nightingale's cleanups in hospitals, it was decided that a corps of female nurses should be added to the Union Medical Corps. Some hospitals contained nuns, whom were often more liked than the nurses. Women took over supervision of the kitchen, and hospital food improved greatly. Richmond was known as the hospital center for the Confederates, the largest hospital being Chimborazo, was thought to be the largest hospital on the continent and could house up to 8,000 men. By 1864, the Confederates had a total of 154 hospitals, though none were as great as Chimborazo. Washington's hospitals could only house 2,000 beds altogether, but in 1863 its general hospitals were replaced with pavilion hospitals, and by the end of 1864 Washington had 16 fine hospitals. Penicillin was the first antibiotic. It was discovered by Alexander Fleming. It was important because beforehand doctors had no real way of treating infections. The Civil War used very little antibiotics, and it wasn't until 1928 that penicillin was discovered. Penicillin was first used in World War I. It was used to fight bacteria. Penicillin had a great impact on the survival rate of patients. In World War I, pneumonia killed 18% of soldiers. This fell to just 1% in World War II due to the use of penicillin. Other antibiotics discovered after penicillin include streptomycin, discovered in 1943, cephalosporins, discovered in 1953, and gracefulvin, discovered in 1960. Penicillin specifically killed the bacteria Staphylococcus. Hand washing became more common in 1847 when Dr. Ignaz Semmelweis realized that fatal infections were being spread because doctors failed to wash their hands. Hand washing disinfects a person's hands, reducing the spread of bacteria and viruses. A study from the U.S. Centers for Disease Control and Prevention estimates that 1.2 million infections in American hospitals could be prevented by proper hand washing. Hand washing should be a common hygienic practice to prevent the spread of germs, viruses, and bacteria even outside hospitals. Regular hand washing can prevent the spread of illness like the cold or flu. Antibiotics cause the cell wall of a bacteria to disintegrate, killing or inhibiting its growth. Antibiotics are important because they stop and fight infection. Streptomycin was the first remedy for tuberculosis. Cephalosporins was created to treat pneumonia, strep throat, staph infections, tonsillitis, bronchitis, and gonorrhea. Gracefulvin is used to treat ringworm in athlete's foot. Erythromycin treats infections caused by bacteria like Streptococcus pyogenes, Streptococcus pneumonia, Mycoplasma pneumoniae, Staphylococcus aureus, and Neisseria gonorrhea. Nimocin fights E. coli. Other ways to prevent bacterial infections is to keep a good immune system, having a balanced diet, and getting enough nutrition. Good bacteria are called probiotics. Examples are L. acidophilus, which is found in the small intestine and creates a protective barrier in the intestine. It also supports the immune system, and humans would have difficulty living without it. Another example is B. lactis, which is also found in the intestines and helps other good bacteria as well as support the immune system and cellular health. Humans could likely survive without this probiotic as it is useless by itself. A third example would be Lactobacillus, also found in the intestines and helps with digestion. Humans would have difficulty functioning without it. Antibiotic resistance is when bacteria resist antibiotics. We should be concerned about antibiotic resistance because this makes bacteria harder to fight. Antibiotic resistance occurs after a bacteria has been treated, resulting in selective pressure or natural selection, where the strongest genes are passed down. We can prevent antibiotic resistance by making sure we're using the right antibiotics, getting vaccines, and keeping good hygiene. Bacteria can become resistant by genetic mutation or acquiring resistance from other bacteria. Antibacterial products aren't any more effective than keeping good hygiene. They can contribute to resistant bacteria. Antibacterial products include soaps, detergents, lotions, and disinfectants. Some antibiotic-resistant bacteria include Staphylococcus aureus, MRSA, Neisseria gonorrhea, Enterococcus, and Mycobacterium tuberculosis. They are dangerous because they are hard to stop. They spread easily because there is little resistance against them. Antibiotic resistance can be controlled by appropriate use of antibiotics, surveilling of bacteria to forecast resistant development, and taking measures to prevent disease. Antibiotic resistance is likely to become more of a problem in the future because bacteria will continue to evolve and develop. We are the cause of bacterial resistance. This problem can be solved by the correct use of antibiotics, prevention of diseases, and good hygiene. Probiotics can slow the spread of antibiotic resistance.